harmony, collab for sustainability. I am Chacha, and I'll be your host for today. All right, good morning. It's not a very early morning, but how are you guys today? Good? All right. Today will sadly be our very last day of UTILARA, but we've got a lot of exciting things planned, so let's make the best out of today. Today is the day you've all been waiting for, where our judges will assess your work on the case study competition. Are you guys nervous? I hope you guys are well prepared to finally present your final work to our judges. And make sure everyone is on cam so that we could start our judgment. So everyone can please turn on their cameras. We will wait until everyone turns on their cameras before we proceed with our event. So can everyone please immediately turn on their cameras? All right, first things first, I would like to introduce our lovely judges for today. There is Kakarina Suryawinata. She is the one who gave you guys the SDG crash course on day 1. Say hi to Kakarina. Hi, Ka.
Hi, everyone. Morning.
Morning. All right, and then there's also Kak Rehan Yamaduma, who gave us a detailed presentation on a specific topic, good health and well-being. So let's give them a warm welcome. Woo, hi. Okay. For our presentation, each group will be given 5 to 7 minutes to present their work. And note, we will be presenting your poster, not the article. And also, we will be the one sharing the screen, so you won't have to share the screen. And then there will be a quick 3-minute Q&A session from the judges afterwards. So please pay attention to your duration because it is part of the assessment rubric. And more on the assessment rubric for your article, you will be judged based on grammar and overall text structure, material suitability, on how relevant it is to the main topic, and the solutions you came up with. And for today's presentation, you will be judged on the validation of the presentation's content, poster appearance, so the design output, how you deliver your presentation, are you clear, are you fluent, and as I said before, your presentation's duration will also be assessed. Also, another reminder, the order of the presentation will be shuffled, so please be prepared to be called. All right, without further ado, let's start the assessment of our case study competition. Calling up the first group, which is going to be group, oh my God, are you guys nervous? Group GH1. So for the members of GH1, you may start presenting your work. For GH1.
Thank you. Good morning, everyone. We are Group 1 of SDG 3, Good Health and Well-Being. Sorry, excuse me as I... There. We are here to present our case study focusing on the health sector of, as you can see, the Philippines. Now, before we start, there will be some Filipino terms, but so as to save time, I will put the definitions in the chat box for everyone's reference. So, one of the biggest problems in the Philippine health sector today is the inequity in the distribution of healthcare to the residents, especially in rural areas. This is mainly because the Philippines is a highly centralized country, meaning that a lot of development occurs in the big capital city, leaving a lot of the other provinces underdeveloped. This could be in urbanization, education, and healthcare is no exception. The health facilities and technologies in Manila is vastly different from those in the further regions. This problem was highlighted in the pandemic era, where we see COVID patients outside of fully jammed hospitals contained in street corners and even roadsides. And now the solution we came up with centers around the concept of telehealth. Now, telehealth is the use of digital info and communication technologies to access healthcare services remotely. This can be through patients having appointments with their doctors through the phone or through video calls. This is a way so that people from far away or those with limitations in their movement can access healthcare from the comforts of their homes. However, there are some flaws to telehealth. First up, it requires the use of gadgets and good connectivity, which we all know not everyone has access to. Secondly, there are some processes and checkups that require direct contact, an example being blood testing. And finally, this does not address the problem that facilities in rural areas are much more underdeveloped. Telehealth services do exist in the Philippines. However, it is underutilized and expensive. A study showed that only 2 in 5 Filipinos actually find these telehealth services affordable. So this presents the need for a concrete solution that is both affordable and accessible to even those in the most rural areas. So here is our proposed solution named Project Reach. From its name, its goal is to reach the far and underprivileged areas of the Philippines and inspire the spirit of bayanihan. We conceptualized this project with the help of ideas from Indonesian and Thai telehealth services, and it is also heavily based on the BERT system in the Philippines. To give context, the BERT system is the Philippines' response to the recent pandemic. It is integrated with telehealth as it utilizes the LGUs of the area to track and monitor COVID patients, deliver medicine, and refer those with severe symptoms to different hospitals, all from home and free of charge. However, this is only for cases of COVID-19 and not for general health. This is where our proposal comes in. Project Reach seeks to employ similar mechanics that the BERT system used with some adjustments to facilitate those with different concerns from COVID-19 and those living in rural areas. Now let's discuss the steps in this project if I was a citizen with health concerns. Firstly, I will call a specified hotline in my barangay. This hotline will be a specialized health unit in the barangay who will then refer me to an expert based on my concern. Doctors can vary between general practitioners, specialists like ophthalmologists and cardiologists, and even therapists and psychiatrists for mental health concerns. These doctors will be sourced from able hospitals nearest to my area. Here, I can have appointments with these doctors for checkups in my home. This can be through phone or video calls. The prescriptions for treatments will be given to the botika ng barangay or the local pharmacy to be delivered to me. And in cases where the disease is severe and needs treatment from a faraway hospital, the doctors will send mitigatory medicine to me so as to dull or lessen symptoms until I am able to be mobilized to the designated hospital. Now, for this project, all steps up to the checkup or appointment will be free of charge. The steps after will cost the patient, but it will be kept as affordable as possible. So this project will be requiring a lot, coordination with the local governments is a must. Of course, this implementation will be case to case as every region has different resources and different needs. As this is only a proposal, a lot of these steps are flexible and open to change, depending on the needs of the area being administered. These are all to inspire the idea of bayanihan within the country and its regions. Us as youth have a role to play, and we can help by thinking of solutions like these and coordinating with the right people. This is a nationwide concern, and that is why it also needs a nationwide effort and initiative. That will be all for our presentation. Thank you very much for listening.
All right. Thank you to Group GH1 for your lovely, lovely presentation. Now we would like to invite our judges to give their opinions on your work. So Kakarina and Rehan, the floor is yours.
Okay,
Okay.
Rehan, would you like to try first?
Yeah, sure. Okay. So first of all, that was a great start for the presentation. And just give me a second. Do you want me to tell the scoring or just my comments on?
I think feedback only, Rehan.
Oh, okay, feedback only. Okay.
Yeah,
Great.
yeah.
So yeah, so something that I liked about the content plus like the article in relation was how original the issue was. You guys focus on telemedicine, and then you guys, especially the presentation, started off with like the broader um, issue, the SDG, and then sort of funnel down to a little bit more specific issue, and then like the recommended solutions. So presentation wise, I felt it was really good. There was some objective information that was presented, so I really like that. Like, you can't present a lot of objective information during a presentation, but it's great that you guys added some of it. I felt it was quite coherently presented, and even the recommended solution was relevant. So I thought it was great. The only thing I would really ask you to improve is on the poster front. The poster was great in terms of how you guys have spoken about the issue and the solution. But as a viewer of the poster, I would have really liked if there could have been one small part about the SDG and the connection between the SDG and the issue. You guys made the connection during the presentation, but not necessarily in the poster. But all in all, it was really good. Yeah.
Okay, thank you, Rehan. Just to keep the time short, I think I love the idea of what you're proposing here about the solution of using telehealth. I believe that the system has been going. Telehealth is a little bit tricky in the rural area, definitely, because you legit references regarding that, and using a mobile phone is sometimes also a little bit tricky in rural area because not everyone has mobile phone in the rural area. So I think overall the presentation is going really well. I have a good score for you guys, but would love to hear more about the issue part, I think. Thank you so much, guys.
Thank you, Kakarina and Rehan, for your insightful feedback. I'm sure it will be very useful for the members. Also, little note for the next groups who are going to be presenting, we'll remind the duration on the Zoom chat. So please pay attention to that so that you know how much time is remaining. Okay, moving on, we will call the next group, which is GH5. So to members of GH5, you may start your presentation.
Okay, good morning, honorable judges and friends. Today, our group will present the result of our case study about how we can find differences in people's reaction towards COVID-19. So do people actually react to this global pandemic the same way? For starters, I would like to invite my friend Nicole to start our presentation.
Thank you so much, Alexa. It was long after COVID-19 was declared as a global pandemic. After years of struggling, we can now finally see the efforts each nation has made to decrease the negative impacts to their country. Take the Philippines as an example, where fortunately the numbers of cases are going lower and lower every day. In Thailand, where the government has made outdoor mask wearing voluntary. Unlike Indonesia, where cases seem to still rise day by day, each nation has a different reaction towards handling COVID-19. We decided to take a closer look into how this nation counters COVID-19 and find out what are the setbacks during the process of trying to tackle the virus. Thank you.
So after knowing the general picture of what's happening in different countries in the world, our group decided to focus on one country, which is Indonesia, where in Indonesia, there are efforts into convincing the public so that they could help create herd immunity to fight off COVID by fully vaccinating their citizens. However, this effort caused few issues and controversy in the start. Number one is people relying on traditional medicine, especially in rural areas where they lack education and there is a strong rooted cultural beliefs leading them to favor traditional medicine that is relatively more cheaper and accessible. Number two is that people are refusing to take vaccines due to religion beliefs, as they believe that the vaccines contain something that goes against their religion. Although this is proven false, but it definitely created a setback into Indonesia's efforts into fully vaccinating their citizens. And number three, that this led to a lot, because there are so many false news circulating around the vaccine, it creates or causes public confusion and leads to public distrust towards the government. And we can see that through all of these factors, we can conclude that Indonesia struggles in actually fully vaccinating their citizens. However, recent data shows that at least 86.57% of citizens have received the first dose of vaccine, and around 72.76% have received the second dose. So how is it actually possible? Well, the new regulation of government forces people to take vaccines, which creates this mindset of receiving vaccines as an obligation instead of personal awareness towards one's health to achieve herd immunity. Where the new regulation where the government forces people to take the first or the second dose of vaccine because they cannot access public spaces without taking those vaccines. Where this raises a mentality where Indonesians have a hard time on actually building a healthy lifestyle and achieving herd immunity. So as a young generation, how can we help and fix this type of mentality?
Our group has come to identify that indeed there are certain factors on how the Philippines, Indonesia, and Thailand react to global pandemics, such as COVID-19. But as we go along with our research and discussion, it turns out that all identified factors, such as reliability on traditional medicine, religious beliefs which affect the trust on vaccines and their science, and the spread of fake news were all evident in each country, but in varying levels and intensity. Hence, there is still a rise in numbers of COVID-19 cases in Indonesia, while there is a slow decrease in the other two countries and already easing through the new normal. We are not at all entirely different after all. As it turns out, each country's culture and strong leadership play major roles in helping the citizens rise above the pandemic. Moving on, we are one in appealing to each of our nation's leaders to uphold the welfare of their people by ensuring that they educate them with only correct information, reaching out to them most especially to the lowly by helping them have easy access to healthcare, by being effective, consistent, and systematic in implementing the rules with respect and high regard for humanity. And yes, we are all responsible as well for our own health, and it really should start from us. Thank you for listening and have a good day to all.
Wow, thank you, GH5, for your very detailed presentation. Now, for Kakarina and Karehan, you can ask questions or give feedback to GH5.
All right, Rehan, shall I go first this time?
Sure, yeah.
Okay, all right. GH5, thank you so much for the presentation. We really love to hear more about the effect of COVID-19, the pandemic, to the global health. I wish we can explore more on the difference on each country based on your articles, as I see more about Indonesia at the end. But thank you so much for putting a lot of stats and facts, which I love the most. You have put a lot of good references there. But yeah, I think all good, I think. Rehan?
Yes, yeah. I also thought I actually thought the poster was one of the best posters out of out of all the groups, because I really liked how visually it sort of looked at the three countries and the factors. And because usually a lot of viewers, when we send this to the general public, don't have the technical knowledge to understand. So I felt like the poster was very geared towards the general public understanding what this issue is. So I thought it was a great poster that helped build awareness. The presentation itself, I really liked how you guys spoke a little bit about the government and how the issue was connected to the government and people's beliefs. That goes to show that you guys have focused on that, the sort of political aspect of it, which is great, because by the end of the day, the case study is about you guys going out there and thinking about different issues. So it was great. I would say the presenters were a little bit too fast. It would have been great if you guys just took a deep breath and just slowed down. Yes, but other than that, it was a great presentation. Yeah, job well done.
Okay, thank you, Kakarina and Rehan, for your feedback. And also, another additional note, the presentation will be 7 minutes now because we do actually have the time. So you can slow down and elaborate more on your presentation. Okay, moving on to our next group, which is GH7. To members of GH7, you can start presenting your work.
Okay, so good day, everyone. So good day to everyone in this room. We are group GH7. Here are the members of this group first. So first is Davina from St. Ursula. Second is Maureen who is also from St. Ursula. Next, we have Maria from Theodorus Kotamabagu. And lastly, yours truly, Sean from Third School. So obviously, for now, we are going to discuss the case study article that we have created and developed as a group.
Before we proceed, we would like to inform everyone that our groupmate Maureen won't be able to present today since she is absent from this meeting. However, she had contributed in giving some ideas in writing process and creating the infographics. Also, we are very grateful to be given the opportunity to give a presentation regarding the SDGs third goal.
So let's get started, shall we? So the name of our case study is called The Awareness of Indonesian Regarding Their Country's Healthcare. From that title, you'll be able to figure out immediately what the case study is about. In the short term, we will incorporate awareness to SDG goal number 3.
So that's right, Maria. So the infographics that we made basically summarizes the entire article that we have accomplished. It is divided into 6 sections, including the title section. With the final output we have submitted, we tried making the information included there concise as it could be for easy readability. We used a lighter color palette to show that we are trying to talk about something important. Also, we added some simple elements such as the icons related to health to make it more aligned with the theme.
Okay, thank you, Sean. Next, in the second section, as you can see, we defined what SDG number 3 is. We mentioned what is its main goal, which specifically aims to ensure people's health and well-being at all ages in the society. There are a lot of targets for this third goal, such as reducing maternal mortality, fighting communicable diseases, just like how the world are currently fighting what has been spreading around us, which is the COVID-19 disease. And then there's also promoting mental health, which unfortunately many people still haven't acknowledged the importance of it. Also preventing and treating substance abuse, achieving universal health coverage, and many more. Now, why is ensuring people's health and well-being important? Why do we need to pay attention to these things? Well, I believe you already know the answer to those questions. It is, of course, a fact that health is a crucial key for us humans to be able to live in this world, right? We need to be healthy in both mind and body first before we get to step out and create things to change the world. Okay, so now we're moving on to the third section, which we have provided the data regarding the number of Indonesia's maternal mortality in 2021. It is concerning to know that the data we obtained shows that the number has increased due to COVID-19 and also the poor hospital accessibility in some places in Indonesia, such as in remote villages. It was really upsetting. Now, Maria, would you mind explaining us the solutions we came up with?
Sure, I will like. For the fourth and fifth section, we have enumerated some of the solutions we've identified that are feasible. For this study, we have decided to go with more of a general solution. It was divided in 2 parts, which are the things that the government can do with their resources and simple way that we as citizens can do to help. On the one hand, the government can improve health facilities, which will improve accessibility by fairly distributing the number of hospitals, especially in rural or isolated areas. They can also conduct seminars in school regarding the importance of mental health, the downside of drug abuse, or even how to prevent a certain disease. On the other hand, citizens can participate in events by paying attention to the mental health of people around. For example, checking up on them if they have having trouble in something. We can also help maintaining the environment cleanliness and our own hygiene, participating in blood donation if you are already 17 or above. Last but not least, launching an only campaign that could be useful in raising more awareness.
So at the end of this infographic, we left a simple note on the things that the reader should take note as they apply the things they have learned from the study. Just to summarize the infographic, our health is vital in sustainability and we should be prioritizing it. Awareness will be the key to a change wherein other people will benefit.
So, as we end this presentation, we would like to remind everyone that health is something that we should put on our top priority, and that we also want to say the small things we do to help can bring a positive change to other people around us.
Once again, we are Group GH7 and we would like to thank everyone in this room for listening, and we hope our presentation and infographic could be helpful in spreading awareness regarding the SDGs third goal. Thank you.
Okay, thank you, G7, for your amazing presentation and your poster. Now for Kakarina and Rehan, you can start your feedbacks and questions.
Go on, Rehan.
Sure. Oh, okay. Yeah, so I think I'll start off with the positive. So first of all, the poster was actually very well put together in the sense that it was broken down really well. I liked how each section was balanced out because even in the article you guys had sort of spoken about you had like the issue and then the government, what the government can do, what the people can do, all of that, like, and each section was balanced, which I actually have to admit I didn't see in the other articles, because it's important that you have it, not that it's important, but it's really nice that you have a balance when you write. And the poster visually also had a great balance. And the most important thing about the poster I felt was that it focused on what the government can do and what the people can do, which is quite important, because if you are going to build awareness through a poster, it's sort of like you're opening a can of worms saying, there's this issue, right? And by the end of the day, if the reader is done with the poster, they need to be going home with something that they can do, feeling they have control over their lives and their problems, right? If someone reads a poster and then feels bad about themselves and bad about the world, it really is counter-effective. So I felt this poster actually did its best to sort of look at both what can be like the issue and what can be done, which is great. Presentation wise, again, I thought it was good, but in terms of starting any presentation, I would say a little bit of general tip is to start off with the topic in order to grab the attention of the audience. It needs to sort of put your topic out there and sort of like a bait for fish and get the audience interested, right? So just a general suggestion, but yeah, good job.
I think I agree with you, Rehan, completely. I actually found joy when I read this the article from this group, because it's really well structured. You lay out all the issues at the beginning, and then the solution given by your team is really structured. So you particularly separate the one from government and the other one for the individual. So I really love that. And then you really answer the question of the goal for the solution. So it's really good. But for me, the presentation slide, it can point out more details on the particular work that you want to emphasize to the audience. I think it will be good to bold some of the words, the most important one, because you put a lot of text, right, in the poster. So sometimes people don't really have time to read. So that's why I think it will be great to bold several parts. But other than that, good job.
Okay, very nice suggestions from Kakarina and Karehan. Now we can start moving on to our next group, which is GH2. So for members of GH2, you can start your presentation.
So good morning, judges and other participants. We are group 2 from Good Health that includes me, Aurelia, Nucha, Adrian, and Diva. Unfortunately, Diva couldn't join us today, so the three of us will be presenting our case study.
So let's talk about SDG goal number 3. SDG goal number 3, or good health and well-being, is significant for every human life. As you already know, according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. SDG third goal aims to provide health and well-being for all people by eradicating the epidemics of AIDS, TB, malaria, and other communicable ailments, and paying attention to child health and maternal health by 2030. Additionally, it seeks to provide universal health care and make everyone access to medications and vaccinations that are reliable and safety. SDG third goal is being implemented in Indonesia. Some major progress has been made by the government and citizens. Based on the Indonesian Union data, most health cases have decreased throughout the years for the maternal mortality ratio, number of infant deaths, and mortality rate of children under 5 years of age, and the infant mortality rate.
Although SDG third goal has a positive impact for the country, it still hasn't met the standard as it was intended. Indonesia, as a developing country, still needs some improvement in health and well-being. There are three main factors that contributed to the lack of progress. First is education and knowledge. Majority of Indonesians, especially who live in the hinterlands, still encounter inequality in education to gain knowledge about health and lack health services, because the government only raises it publicly when there is a pandemic or terminal illnesses. As a result, they tend to lean more on their religious beliefs. Some religions have their own principle about health, such as diet, hygiene, blood transfusion, pregnancy, etc., which is actually a good thing. But if they only depend on their belief, they would choose faith instead of seeking medical care. Second, the environment. Majority of Indonesians still turn a blind eye to conditions. Still damaging for the environment, such as usage and waste. These could cause a variety of pollution that would affect one's health deterioration. Lastly, discrimination. There are discrimination towards specific groups in Indonesia when seeking healthcare, ranging from racism, ageism, sexism, and to tokenism. The healthcare quality that they receive is inequitable to get immediate health service treatment compared to those who have higher socioeconomic background. As a result, these factors hinder Indonesia's good health and well-being growth throughout the nation.
Okay, next I'm going to explain about our solution for good health in Indonesia. And so we collect this solution from our discussion based on the data we collect from Indonesian Ministry of Health. So according to the Indonesian Ministry of Health, Indonesia is currently facing a triple burden of multiple levels of illnesses, which are stated as the occurring infectious disease of COVID-19, other poorly managed infectious diseases, and the increasing number of non-contagious diseases. And unfortunately, according to the data collected from the Indonesia Statistics Bureau, due to the low level of awareness among Indonesian citizens, the most concerning issue is the significant increase in the number of non-contagious disease. So it's not COVID-19. If this continues to happen, the number of cases of catastrophic disease will likely to increase soon. And therefore, we have discussed some solutions to overcome the problems that are occurring in Indonesia. These are our 6 simple thoughts on preventing and curing conditions in Indonesia's good health problems, and as a way to accomplish our SDGs purposes. First, the government can improve healthcare services, including health promotion or disease prevention and management. Secondly, to educate people about the risks of having these diseases, the prevention method and the curing procedure. Third, altering a bad lifestyle into a better one. I think this one is still quite hard to achieve because the low level of awareness. Then we can also do medical checkups frequently to minimize the risk and have good rest for better productivity. And lastly, always remember to wear a mask since we are in a post-pandemic situation. So in conclusion, it is clear that SDG number 3 has a big impact on Indonesia's health and well-being. The developed nation has a better healthcare system and lower mortality rates. Meanwhile, Indonesia, it is the opposite, as Indonesia still has some weak aspects in delivering healthcare to their citizens. Hence, in the future, Indonesia could do some improvements according to the solutions that have been given above as an assurance to enhance its well-being. I think that's all from us. Thank you.
All right, thank you for your presentation and your amazing poster. Now let's hear from our judges.
Okay, thank you so much, guys, for presenting this presentation. I would say you touch base on a good data, I think, based on the Indonesian ministry. So you lay out all the issue, but what can be improved is actually when you describe about the solutions, some of them are actually incorporated into one solution. For example, educate people, and then you have wear a mask, and also the other one have a good rest, right? Those things are actually can be included to the educate people as well, because that's how we do the campaign, right? That's why we raise the awareness of people that actually wearing a mask and have a good rest or having a good healthy lifestyle are actually beneficial for maintaining your health and well-being. So that's the first one. And then the second one about the government to improve the healthcare facilities. It's not only improving the health promotion, but also you can also say to improve the facilities, resources, and also access, because people not all people have the same access, right? So yeah, but in terms of the layout of the presentation, I like it. It's just using structuring. Make it less complicated will be better, but that's the way you make a scientific poster, right? So that's okay. Thank you so much. Rehan,
yeah, I actually, yes, yeah, thank you. Yeah, I actually agree with what Karina said, because the solutions I feel could have been a little bit more pronounced, because it's because even in the article, I think it's important to identify solutions, meaning like we can urge people into healthier lifestyles, but it's also important to say how we do it, right? Like how do we encourage people into changing their lifestyles, right? And it can be something as simple as a parents teachers meeting is happening in 2 weeks time, and you speak to the teacher in charge and you get sort of like a presentation up there while the parents are in school, and you get them to sit through like a 30-minute presentation on changing lifestyles, or how they pack their food for their kids. So I think it's important to also emphasize a little bit on the how. Presentation wise, I thought it was good in terms of like the information that was presented, but like the flow was a little bit complicated, as in like if I started at like here, I was a little confused, do I go this way or that way? So I think it's important to have that visual flow as well, so the viewer is not confused. But yeah, and I'm not sure if Karina might agree on this, but I felt like maybe the graphs could have been removed from the presentation, because when printed, I felt like some of the viewers might not understand the graphs, like that. Whereas maybe like adding a sentence like 2 in 5 children that are being born every day die due to malnourishment, like something like that maybe would have driven home the point, versus like 3 graphs. And maybe you could have utilized that space better for the solutions. So yeah.
Yeah, Rehan, I agree with you on the graph actually, because it's all going down, right? You can just simply say the fact that actually it has been improving, but then there are still lacking of blah, 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 blah.
Yeah. Yes, yeah. So yeah, great presentation all in all. And yeah, thank you.
Okay, thank you, Kakarina and Rehan, for your insights. And now let us move on to the next group, GH3. So for GH3, you can start.
Before we start on the poster, I would like to say that one of our members, Pin, can't be here with us, but she has contributed to our ideas and the creation of our poster and article. Thank you. So now, picture this. A girl was just having a normal day, and then she suddenly felt lightheaded and drowsy. She suddenly felt symptoms of the flu. She was very ill and weak. She then asked her parents for help and to give her medication. But because of their very traditional mindset, they refused to give in to Western medicine. The girl then continued to suffer not only physically but also mentally, as she felt as if her family was against her. She eventually was able to be examined and helped by a doctor, despite her family's disapproval. Even though she felt better due to this, she felt more distant than ever with her family. Now, this story may not have specifically happened, but we guarantee people have struggled with the same sort of issue due to people having a traditional mindset and social stigmas. This may have happened in the past, so we want to ensure it won't happen again in the future. That is why we chose to contribute in stopping this from happening again.
Yes, that is why we, Oucher, we want to prevent this thing from happening ever again. And in this case, we're talking about a problem with SDG number 3, which is good health and well-being. We're talking about a traditional mindset or a social stigma that affects a person's ability to access quality healthcare. And in Indonesia, most times we get our information from our family members. We get medical information on what medicine to take from our family and what to do in case of an emergency from our family. So if our family has this kind of mindset, then it affects us directly because they're our main source of information regarding this. And a practical example of this problem can be seen from a 2021 study published by the International Journal of Mental Health Systems on the types of stigma experienced by patients with mental illness in Indonesia. They found that at least there are 4 different types of stigma that people with mental illness experience in Indonesia, which are 1, personal stigma, 2, family stigma, 3, social stigma, and 4, employment stigma. So breaking it down from the closest one, which is personal stigma, it affects their own mind, it affects their own health. They feel like they're not themselves anymore. And with family stigma, well, it's in the name, they're affected by their family and their family members who might have a traditional mindset and say, oh, you shouldn't take this, you should take this instead. And social stigma would probably be their friends and their society. And employment stigma, which is, in my opinion, the second most important one, it's regarding their professional life and how they make a living. So these findings suggest that a person's health doesn't only affect their own health and their family's health, but it affects their entire life. So this problem with healthcare isn't a joke, and it can possibly ruin a person's life, from their personal life with their family and their friends up to their professional life and how they make a living and how they can support themselves financially.
Now, despite the issues that are present here in Indonesia, we have come up with a solution to be the first step of change. We want high school students around the world to have the means to start change, and one way to do that is through Oucher, wider outreach for a better future. So, as stated on the poster, I would like to raise the question, what is Oucher? Oucher is a campaign founded by 4 high school students in order to balance cultural knowledge along with modern day medications. Everyone has their own culture, and it's even more apparent when you're sick and your parents want you to take a never proven before medicine because it's what they're familiar with. And of course, it's in no way their fault.
But we want to be able to balance these habits with updated knowledge. We do not want to erase culture, and we are only interested in making use of the years of modern research available. Now, getting back to the poster, on the bottom side, we have Oucher's activity list. The first of two is an informational session for everyone. Some of these sessions will be held offline and open to the public, while the others will be held in collaboration with local schools to educate both parents and students. Basic knowledge of healthcare will be given, and everyone, no matter their age, will be involved in group discussions where exchanging knowledge is the priority. We would also target certain health myths that are common to us. Next up on the list is charity. At every event, donation stands will be provided as an open charity system. The funds collected will then be forwarded to a health and well-being charity. Oucher will be held in collaboration with health organizations as our main resource, as well as social media influencers specializing in health to make the event all the more captivating. Now, it's up to us to make the move and start change. We are Oucher.
A wider outreach for a better future. Thank you.
Thank you.
Thank you so much.
Thank you.
Wow, incredible work from GH3, Outer. That was an incredible presentation. Now for Kakarina and Karehan, the stage is yours.
Rehan, you can go first.
Yeah, that was I was very captivated by it. I felt like I was at I felt like it was a marketing thing that was happening, and I was just like, it was big market, invest in this kind of thing.
I feel like I
really
feel like listening. I feel like listening to a podcast.
yes, yeah, and it was quite clear, like how you guys presented. It was coherent, and I could understand each and every word. So I thought presentation wise, it was great. I also like the commitment you guys have made, those background thingy as well, which shows commitment, which indirectly shows that you guys have taken a lot of time and put a lot of effort. So I would say the presentation was great. Maybe the poster was a little bit more dense in information, but other than that, what I really liked in the article and the presentation was that it focused a lot on the solution, which is great, because we need to speak more and reflect more about what we can actually do about the issue, which I thought was great.
Yeah, I totally agree with Rehan. I mean, like, talking about the presentation, it seems like listening to a podcast. So kudos to you guys for the effort. And with the background as well, I really loved it. It's just when you mentioned in your article about the publication on YouTube, doing the event online, just bear in mind, because mental health is pretty sensitive topic, right? So you probably need to deep dive a little bit on the consent form of the people that you are talking to. I think that's really important as well, because some of them may not, they don't want to be exposed, right? Yeah, but other than that, I love it. Thank you so much, guys. This is really entertaining.
Yes, yeah. And if I may add one more thing, this is actually for everyone here. I thought the focus or the mentioning of the traditional aspect of medicine was really good, because as Asian countries, we have a lot of rich history, and we draw a lot of sort of knowledge from traditional medicine. So I thought that was great. But a little bit of food for thought for everyone is that when we speak about traditional medicine, especially like in my case, I have had a Western education, and when I work with Sri Lankans, and when I go into traditional medicine, I'm like, what is this, right? Why are we not focusing more on Western medicine, right? Because it's more research and scientific oriented. So yeah, but the thing is, in my experience, I have seen that traditional medicine plays a huge role in preserving the livelihood of communities. I guess in Indonesia, it's much more. It plays a bigger role, because you guys have, I believe, 10 times the population of Sri Lanka, and you guys have said that the development itself is very centralized, meaning that the rural areas should be at logically higher, like highly dependent on traditional medication methods compared to Western medicine. So when speaking about traditional medicine, I would also say have like a sit on the fence and be like, what are the positives? What has it offered our communities? But also, what can traditional medicine take from Western medication and Western sort of pools of knowledge as well? But yeah.
May I share a little bit story
Of
about
course.
the Indonesian perspective regarding that? So when I was working in the slope of Mount Agung, so it's pretty rural, but frankly speaking, to be honest, back then, the traditional medicine health practitioner and also the modern health practitioner are working together, Rehan, in Indonesia. So because that's the only way they can reach out to the people. Because regarding the distance, regarding the access infrastructure, it's not easy to go to the healthcare facilities. So the only people that they can count on is actually the shaman, the local people who can do something. But then the way the hospital teach these local shamans that they collaborate with them and educate them on like, hey, if using this, it will have an impact on the health side. So they're well informed and they do the practice. I can say better, safer. But nowadays that gap has been a little bit stretched because we are growing more on the modern side, right?
Yeah. Same thing with Sri Lanka. There's a huge sort of disparity clash between the two sides, which ideally shouldn't happen, because if you work together, you can accomplish a lot more.
True. Yeah.
So I believe as future sort of activists or change makers, it's important to look at like the both sides and not take one side, because it's easy when we are having a Western education, it's easy to give credit to one side. But
definitely.
Yeah. So thank you for sharing that, Karina. Like that's such a
Okay, let's go back to the second.
The timekeeper
Sorry,
is
guys.
like on us.
Yeah. Sorry, guys.
Okay, thank you, Kakarina and Karihan, for the new information we just learned. I'm pretty sure it's going to be great insight for everyone here, and also great work for GH3 for the amazing presentation. Now, the time is moving, and we are actually down to our last two groups. I hope that is not a pressure to you guys. For the next group, we are moving on to group GH4. So for members of GH4, the stage is yours.
Okay, hello everyone. We GH4 that consists of Russell from Tennessee College, Ani from Mater Dei, Renz from Lawrence High School of Mandaluyong, and me, Chacha from St. Ursula, Jakarta, will be presenting our infographic titled Indonesia, Fulfilling SDG number 3 and the Roadblocks. To start off, Indonesia is the largest archipelago in Southeast Asia. It leads international development with a population of over 273.5 million. However, a great population demands high standards of healthcare. Through further analysis of Indonesia's health and well-being related factors, it can be seen that the country has issues regarding its healthcare. In this essay, the factors impacting Indonesian well-being will be discussed, and some recommendations and solutions will be proposed in an attempt to resolve these deeply rooted issues in the country.
Okay. First, I'll talk about the knowledge of health itself in Indonesia. The knowledge of health in Indonesia is relatively available to most citizens, as the Indonesian education system educates students quite early about diseases and health in general. Not to mention, the country also has traditional herbal medicine, like other groups have said earlier, which can often be used as an alternative cure to illnesses. And up to this day, younger generations still are educated on this field. And another thing to note is that Indonesia has a lot of trained health professionals. There's around 180,000, with 143,000 being general practitioners and the rest being specialists. In the past few years, the internet has also become quite a reliable source, as Halodoc, a relative new company, has become this telehealth sort of system where Indonesians are able to easily consult doctors and have their medication prescribed digitally, and they don't have to meet up face to face. This new app is very helpful in achieving universal health coverage in the country. However, there are still many setbacks when we are trying to achieve universal healthcare coverage. As in the most recent reports, the ratio of doctor to patients is still way under the WHO ideal, which is 1 to 1,000. Not to mention, around 70% of practitioners are still in the island of Java. So the rest of the country only have 30% to deal with.
Furthermore, the price of healthcare is surprisingly prevalent silent in Indonesia. Although it's pretty low compared to other countries, and it ranks 134th among healthcare prices for insurance around the world, the national health insurance the government had to issue the National Health Insurance Program to improve healthcare insurance cost coverage, and this achieved health insurance for 83% of Indonesians as of 2019. However, when compared to other countries, that's still pretty low. And in fact, 32% of Indonesians are still paying for this health insurance out of their pockets. This is because Indonesians with informal work remain threatened in their lifestyle aspects by the cost of health insurance.
Rampant discrimination also affects healthcare and well-being in Indonesia, especially towards people of certain race, disability, and STD patients. The general populace of Indonesia has a stigma against people with mental illnesses, and mostly it's due to lack of education on the topic. Passing is one of practice in the country. People with mental illnesses have their limbs locked to be corrected. Lastly, there's also stigma against people with STDs. Indonesia is a strongly religious country, considers premarital sex as misdemeanors, and so the population shuns people with STDs.
With all the problem listed, so we then came up with the solution. We will distribute our solutions into two ways. Firstly, social change. Invest promoting healthcare education, gain support from Papuans to a testimony to increase support. Secondly, government change. Spread out healthcare practitioners in the country, stabilize the economy until the complete implementation of existing national health insurance program. Giving our last word, Indonesia still has a long way to go to fulfilling SDG 3. As youths whom the world bets on, we will both be the implementers and the benefactors of the solutions in healthcare coverage. It's important to know more about this as members of the global communities that we might resolve it someday. Thank you for listening until this point. It is very pleasure for us joining the UTILARA. Thank you.
All right. Thank you to GH4 for your insightful presentation. Now to Kakarina and Karehat, you may proceed with the feedbacks and questions.
Okay, guys, thank you so much for presenting this one. I really love that you put the facts as well, but the GP and the specialist. But may I ask you, where did you guys get that number, the total GP and specialist? Is that per this year report or?
It was from a few years ago, actually.
2 years.
I think it was from around 2 years ago. Yeah.
Okay. And I love that you put like 70% of the GPN specialists are all located in the Java Island. That gives us a broad idea that actually the discrepancy of the global healthcare are actually real in Indonesia. And then one comment on the one of your solution regarding the government, what they can do to stabilize the economy. I think that is a long-term goal, because you can't really control that right now. It's a long process. And one more thing for the feedback is that when you present something, maybe one of your teammates don't really see the camera, but focusing more on the script. think it would be great when you present something, you look at the camera, you touch with, you have an eye contact with the audience. I think that would be great. But the presentation wise, all good. I really love the design. I think that's also one of the things that Utopia would do in presenting facts and figures. But yeah, kudos to that. Thank you guys.
Yeah, I also thought the poster was quite creatively put together, and it was visually good. But again, I think what Karina said was actually the main comment I also had. The solutions are great, like even with regard to the article, the solutions are great, but these are like national level solutions and would take like years on years to actually achieve. So I think the main goal of this activity was along the lines of what you can do on a smaller scale. So it would have been great if you guys sort of brainstorm on a couple of things that you could have done on a smaller scale. But still, I think it was good. And even the research, like where you had drawn the information from, I felt it was good. Like Karina said, how you guys use the statistics to show that 70% of the specialists were focused in this area. So I thought that was actually really good to give perspective to people. So yeah, all in all, good work.
Love the post.
Okay. Great comments from Kakarina and Karihan. Hope that would be great insight for GH4. Now let us move on to our last group of today on this GH Good Health and Wellbeing breakout room. No pressure, guys. It is going to be GH6. So for members of GH6, you may start your presentation.
Good morning, everyone. We are from GH6, and now we're going to talk about Philippines health. Why do many people try or want to change the world, but not themselves? The Philippines is a country known for having an abundance of beautiful island and delicious food. But behind every beautiful country, we rarely talk about the contemporary issues they face. Filipinos get basic information and news about health through social media platforms such Facebook, Instagram, Twitter, and even TikTok, radio broadcasts, news, village announcement, and school. Many factors are considered on what affects the people knowledge and perception on health, such as the environment of nature, the people that surround us, the way we grow up, and how we educate ourselves on these kind of issues.
They say you have to be at your worst to become your best. The Philippines has concerning mental health rates, with 6 million Filipinos living with depression and anxiety. In the Philippines, the people stigmatize the importance and relevance of mental health. When young people talk about being depressed, sad, anxious, or even talking about their emotional thoughts and feelings, most people will just say, "That's nothing," or "Stop being dramatic," or even "You're overreacting." Or in Filipino, they say, "Bakit ka depressed? Ang swerte mo nga, nasa buhay mo lahat." Or in English, "Why are you sad when you have everything in life?" These are really scarring things to say, and it's hard for someone to even take. Because sometimes people can be depressed or sad without any traumatic reasons or experiences. These terms have been heard from almost every young person. Just because we grew up in that environment does not mean we have to be like that. We can and should be the person who breaks the line and stereotype for the next generation to blossom and develop into something more.
Now, we all know that an advantageous environment can be a great medium for people to improve their health. On the other hand, a bad environment can lead to the decline of health. In the Philippines, a lot of residents are getting sick due to air and water pollution and lack of hygiene practices. Based on UNICEF, only 80% of the poorest quintile have access to basic water services, and also around 6 million Filipinos still practice open defecation. These environmental issues affect Filipinos' health, and without proper treatment, most of them result in death and chronic illnesses. Now, most Filipinos will seek medical help when ill, but there are still a small amount of people who refuse to seek medical help due to factors like misinformation and superstitions made mostly by old people, which can be pretty common. Now, putting the will to seek help aside, as a matter of fact, based on the Philippines Department of Health, only 50% of the Philippine citizens have access to healthcare within 30 minutes. This is due to the scarcity and uneven distribution of health facilities. However, for the available facilities, there are still noticeable differences in treatment. Wealthy people are prioritized in healthcare, while citizens who lack financial capabilities have more limited options. Most of the citizens only have access to public hospitals because of how expensive private hospitals are. The problem is that the private and public hospitals in the Philippines are like night and day. The medical attention and supplies that are received from private hospitals are cut above than the ones received from public hospitals due to the technology, quality, and worker differences.
So at the end, we come up with the solutions. With all of this said, we can simply sit here and just list off our issue without taking some action. Everything begins with ourselves, the youth of our generation. Reiterating the questions from the world, from our original quote, why do many people try or want to change the world but not themselves? To be able to take the initiative to become the leaders of our community needs, we should be able to critically evaluate our own and other actions. As we grow as individuals, we have to learn from our blunders and encounters. Once we take these actions, we will be able to influence and lead others who are close to us, including our friends and family. From there, we will be able to join the school organizations like school councils or even non-governmental organizations that aid in achieving our development goals. Last but not least, there is no upper limit to improving oneself for our world, since small actions such as these can go a long way and can develop into something bigger. In the long run, let's just put more emphasis on our personal advancements rather than rankings or stats. Thank you.
All right. Thank you, GH6, for your lovely presentation. Now we would like to invite our judges again to give their feedback and ask questions. For Kak Karina and Kak Rehan, you may proceed.
Yes.
Rehan,
Yes, I thought the poster could have been a little better in terms of highlighting the solutions. I felt the presentation itself framed the problem really well. You guys gave a lot of information on why the problem is actually a problem and why people need to sort of, why it's important to look into it. Even the solutions were explained a little bit more in the presentation, but in the poster, the problem and the solutions were not sort of clearly defined, which isn't great on the end of the poster. In addition to that, I would also say now, like what can be done, like is important to sort of identify what we can do, but it's also more important to go the step to understand how can we do it, right? So again, I felt like the poster could have been better. The presentation itself was actually much better. So good work.
For me, I think I'm on the same page with Rehan. I really enjoyed, like, when I hear you guys presenting at the beginning, I feel like there's a spark of lightning because you guys lay out all the issue, like this stigmatization and then the pressure of the society about staying strong, and you guys don't really have time to feel weak, right, with the mental health issue. And then you mentioned about WASH as well, and like 50% have access to only like 30 minutes away from the healthcare facilities and so on. So that's really nice. I can grab all the information from you guys. But as Rehan mentioned before, your poster could be more informative, I think, in terms of that, so that it can complement the way you present it. Other than that, I'm happy with the presentation. Thank you so much, guys.
Okay, good work, GH6. And with that, this wraps up our case study competition for today. Good job, everyone. With such little time, you guys managed to do very detailed research on this topic, and you guys are really creative and innovative with your solutions. And I think it's very interesting that within one topic, you guys could look at it from very different perspectives and give us so many different solutions. And now I would like to call Kakarina and Karihan. Would you like to give your overall thoughts on everyone here and some messages for these future change makers?
Okay, this is the interesting part. So thank you so much from the UTILARA committee for inviting both Rehan and me, and also the other Utopia team and the other Circle of Youth. I think I had a great experience hearing all of the presentation today from you all. I can see the effort, I can see the commitment to really do it really well. I think both Rehan and I are pleased to hear about the presentation. We also have more information about what happened in Philippines, Thailand, and Indonesia. So thank you. We learned a lot today as well. And regarding the article and poster, you've done really well, but there are rooms for improvement always. Especially when for the article, I think especially when you write an article, references are always important. So when you can cite readings or references, it will be great. I think to know the facts, the number, it's always good to know that, especially we talk about health. But other than that, there are things that cannot be measured by numbers as well. If you talk about health, you talk about behavior change, social behavior change, that cannot be measured by number. You have to explain the narrative side of it. And I know it can be overwhelming talking about SDG 3 because first maybe we may not see any improvement in like only 1 year or 2 years. When we talk about social behavior change, for example, it takes years to really see the impact. So solution, I think the solution given should be something that can be sustainable in a longer time. And most of the time when you do implement the solution, you have to be innovative and also flexible. Sometimes things happen in the middle and you may have to change your solution, adapt with the situation at that time. Right, Rehan?
Yes, yeah. So
Yeah.
It's like personally I thought the solutions, a lot of solutions were really creative, and I really hope maybe going forward you guys look into how you can execute maybe a couple of them, because feasibility wise I saw like the couple of really great solutions. So really hope you guys are motivated in that sense. And I think over the past week or so, you guys have been delving into the SDG 3. I'm not really going to say much about it, but the entire activity wise, I will tell you a little bit of a thing that one of my teachers told me. Like sometimes when you get immersed in workshops and sessions, you come out and you have been through so much and you're like, did I learn something? Like, was that time worth it, etc. But one thing that one of my teachers told me was like, if you participated in something and if you can pinpoint a good 3 learnings that you got out of it, then your life has been changed through that experience. So
I was about to say like maybe after this the winner's announcement later on, put yourself in one room and then just spend maybe 3 minutes to really do a reflection, like what have you been achieving this whole week, and I think that's a good takeaway, right, Rehan?
Yes, definitely. Like if you guys can have a quick discussion, that again consolidates what you have learned. And something else I would really like to mention at the end is, now we have been focusing on SDG 3, etc. But you guys also need to look at like the other experiences that you got through the process, right? Because like you guys learned to present, you guys learned to use Canva maybe, and you guys got experience on writing articles. So I think all in all, there's a lot of things you learn from this entire experience. So it was great. And I learned so much about different countries I have not been to, But yeah, so thank you so much for the opportunity again, and it was lovely. So yeah, good luck with everything.
And congratulations for the event, the committee. You've done a great work organizing everything. Well done.
Yes.
All right. We from the UTILARA committee and everyone here would like to say a big thank you to Kakarin and Karehan, who gave us all so much new knowledge and insights that will definitely help us grow and improve in the future. And for now, I actually want to call on some people to share their experience on doing this case study, and maybe how working with different people from different countries. Does anyone want to share their experience and give their thoughts on this case study competition? You may raise your hand. If not, I am going to call on some of you guys. No one? Okay. Maybe I want to hear from GH5 Nicole. Can Nicole give your point of view, your experience during this process?
So this is my first time to follow this UTILARA, and yeah, I feel so better because we down. And then, but my experience is, I meet with a friend with new friend in different country, and yeah, I know what they culture, and yeah, I learn in case study. I learned something new, like about a new about knowledge, and yeah, everything. And yeah, this is a good experience for me, and thank you so much for this event. Yeah, that's
All
that's it.
right. Thank you, Nicole, for giving your thoughts and experience on this UTILARA case study competition. Maybe we could do one more person. How about GH3's Bernardinus Mateo?
Hello. So, from this experience, I feel like I've had a lot of fun. It's pretty great hanging out with other people, especially from different countries. And one lesson that I've learned is probably time management, because we're all from different time zones and we gotta do this project on a deadline. And although it's a little difficult to adjust our times and divide our tasks properly, I feel like in the end we got it done, and it was a fun experience. So thank you, Sanor, for doing this event.
All right. Thank you for you two for participating actively. Okay, maybe one more person. GH1's Jeremy London from Philippines. Would you like to give your opinions and share your experience?
Hi. So well, this is my first international event, really interacting with other people from other countries, and it's been really fun working with a lot of with people from different countries and also making friends with them. I was also able to learn a lot about their country, about their culture, and yeah, all in all, it was a great experience for me, and I'm really proud of, first of all, myself, and of course my group for still executing what we've presented today.
Okay, thank you so much, everyone. We from the UTILARA committee would like to thank everyone here for your active participation, and we are actually super shocked with your work because we gave you like 2 days and you managed to create these amazing posters, articles, and came up with so many different great solutions. And for now, we are going to have a 1 hour break, or more than 1 hour actually, because I think we finished a bit early. We will open our Zoom at 11:30 a.m. GST +7 to prepare to start our next session at 12 p.m. And note that our next session will be in a different Zoom link that will be sent through your WhatsApp or Line group. So make sure you check your notification. And we would also like to ask your help to fill in a secreto link for us. You can fill in your thoughts, experience, and how you felt during the UTILARA event. So please do fill in the secreto, which would be a great help for us. And the link is going to be shared on the Zoom chat or on the group chat. Okay, yeah, it's on the Zoom chat. And yeah, now maybe you can start entering the link first before you leave this meeting. I'll give you a bit of time to enter the link. You can fill in the secretos during your break, so just click on the link first so that it's saved. And now you may all leave this meeting, and please make sure to be back on time before 12 p.m. because 12 p.m. is when the event is going to start. So we hope that you'll all be back on the Zoom before 12. So goodbye, everyone. Have a nice break. Thank you.